According to the circulating message, effective July 2025, the ministry ordered a halt in allowances for medical interns and senior house officers on the government payroll as verified by the Human Capital Management System. Refugee interns and senior house officers and postgraduate trainees pursuing membership or fellowship programs. The Uganda Medical Association and representatives of the senior house officers have since written to the Ministry of Health seeking a meeting with the Permanent Secretary to discuss the matter. They note that this communication comes at a time when the affected doctors have not received their allowances since July, creating confusion given that there has not been official communication from the ministry.
There was no notification. They actually last got paid in June. They have been waiting for their next 3 months' pay, July, August, September. And just last week, we received a message on WhatsApp, not signed, not headed, saying that some categories are going to be scrapped. We were shocked. We thought it was a rumor, only for the payments to actually not be effected. So the rumor was true.
The medical personnel say this move is unfair as they spend long working hours in hospitals and that this allowance is not a salary, it is meant to help them meet basic needs.
Our day starts at 6:30 a.m. By 6:30, there is a team at Mulago in casualty. We are reviewing patients, we are seeing accident victims, we're getting them prepared for surgery. We start the day in casualty at about 8 a.m. You're in theatre from 8 a.m. until 2 a.m. on a good day. You have 2 a.m. to 6:30 a.m. to get ready for the next day. There is no time to seek income in another private facility. If we are required to offer standard of care that is 24 hours, we do not have the time, and that is why government thought it best to give us this allowance. Now this allowance has been scrapped off. We do not know how we are going to get our livelihood.
And maybe they will find it within their hearts to reinstate this money, because our colleagues cannot work without this pay. This small meager allowance of 1 million helps us survive through the course, because we're in the hospital 24/7. We are the first people you will meet in accident and emergency. Unfortunately, if you get an accident, we shall be there 24/7. So I would like to call upon the Minister of Health to really listen to us.
The Uganda Medical Association says that over 300 medical personnel have been affected.
So we have various super specialties, the Department of Urology, Department of Orthopedic Surgeons who deal with bones and the spine. We have the general surgeons who deal with all surgical conditions in the body. We have the plastic surgeons also being affected, those who do surgeries of the skin. We have the neurosurgeons being affected, those who do surgeries of the brain and the spinal cord.
The medical personnel say that withdrawing their allowances without prior notice violates public service standing orders, which require at least a 3-month notice before changing terms of service.
We are also wondering, why is it that when it gets to directives and plans that have been implemented for the Ministry of Health, they are the ones which are tinkered with. When the President says pay the interns 2.5, it is first delayed, later it is paid, finally it is withdrawn, and now they're receiving 1 million. When His Excellency says deploy the interns, they have to stay home for 1 year, 1.5 years. Does health not matter at all?
The Uganda Medical Association is seeking a meeting with the Ministry of Health to discuss the matter further. Efforts to reach the Permanent Secretary, Ministry of Health, for a comment were unsuccessful by press time as calls went unanswered. Norbert Atkunda, NTV News.